I'm Sheila Davies, Director of the Dare County Department of Health and Human Services. The total COVID-19 positive case count in Dare County is 547, of which there are 15 active cases among residents of Dare County. Of the 547 cases, 295 are residents and 252 are non-residents. Currently, one resident remains hospitalized due to COVID-19 complications. Since the last Dare County Department of Health and Human Services update, issued Friday, September 25th, there have been 18 new positive cases. Of these 18 cases, 9 are residents and 9 are non-residents. The Dare County website has already been updated to reflect all of these cases. Of the 9 resident cases since Friday, September 25th, 4 of the cases are close contacts, 3 are symptomatic, and 1 is asymptomatic, and all acquired the virus by direct contact with an individual whose positive test result was reported on 9/25. 2 of the cases are not connected. Both are symptomatic and acquired the virus by direct contact with individuals who tested positive outside of Dare County. 2 of the cases are not connected. 1 is symptomatic and 1 is asymptomatic. It is unclear how these individuals acquired the virus. And 1 case was reported to us yesterday from the state reporting system. This was a late report from when an individual tested positive outside of Dare County. The individual has since fully recovered. Of the 9 non-resident cases since Friday, September 25th, 3 of the cases are family members. All are asymptomatic and acquired the virus by direct contact with an individual who tested positive outside of Dare County. 2 of the cases are not connected. 1 is symptomatic and 1 is asymptomatic. Both individuals acquired the virus by direct contact with individuals who tested positive outside of Dare County. 4 of the cases are not connected. 3 are symptomatic and 1 is asymptomatic. It is unclear how these individuals acquired the virus. Contact tracing has been completed on 15 of the cases, and direct contacts provided by these individuals have been identified, notified, and directed to quarantine for 14 days from the last date of exposure with the positive case. The 14-day quarantine requirement is very important to slowing the spread of the virus, as the incubation period for this virus is 2 to 14 days. We are currently working with the other 3 individuals to identify their direct contacts. Over the past 2 months, we have seen lower numbers of new COVID-19 cases as compared to the number of cases in July and early August. While this is encouraging, it does not mean the COVID-19 virus is not in our community. Unfortunately, just in the past 2 days, we have seen an increase in 14 cases, with 4 of those being 18 years and younger. While more and more people are beginning to re-engage in activities with others, we can expect to see an increase in cases. It is critical for everyone to be responsible and follow the 3 W's to help reduce the spread of COVID-19. The 3 W's are really the most effective tools to help protect yourself, your family, and our community. Please wear a cloth face covering if you will be with other people. Wait 6 feet apart and avoid close contact. And wash your hands often with soap and water for at least 20 seconds, or use hand sanitizer. North Carolina Department of Health and Human Services has recently shared some important information regarding COVID-19. This information includes a COVID-19 exposure tracking app. This is a new app which individuals may download to their smartphone. This app can alert you if you have been in close contact to a laboratory-confirmed case of COVID-19. More information on this app is available at the state's website. The state also announced the Extra Credit Grant Program. On September 4th, Governor Roy Cooper signed into law the Coronavirus Relief Act 3.0. This program provides funds to help families with qualifying children in North Carolina by providing economic support to assist with virtual schooling and child care costs during the COVID-19 pandemic. The grant amount is $335 total for each eligible individual, even if the individual has 2 or more qualifying children. If you filed your 2019 taxes, you do not need to do anything to receive the funds. However, if you have not filed your 2019 taxes, you need to go to the North Carolina Department of Revenue website to submit an application to receive funds. For more information, visit NCDOR's Extra Credit webpage. The state also released Halloween guidance. The state's guidance, modeled after the CDC's recommendations, outlines lower and moderate risk activities for Halloween this year. This guidance can be found at darenc.com/COVID19 by clicking on the Halloween banner. Each week, we review the 4 key metrics associated with disease investigation and surveillance. The metrics are number of tests, confirmed cases, positive test as a % of total test, and COVID-like illness surveillance. This past week, there were 631 COVID-19 diagnostic tests performed in Dare County. This brings the total number of tests performed since early March to 13,010. There were 20 positive cases between September 21st and September 27th. The % of positive tests to overall tests in Dare County since we started testing in early March remained stable this week at 4.10%. The % positive to total tests for the past week alone decreased to 3.17%. Syndromic surveillance of the emergency department showed an increase early last week in the numbers of individuals presenting with COVID-19 related symptoms. The local urgent care centers also saw a slight increase in the number of patients presenting with COVID-19 related symptoms over this past week. These graphs can be found on the Dare County website at darenc.com/COVID19. We strongly encourage anyone who is experiencing symptoms to be tested, as well as anyone who may have come into contact with someone who has COVID-19. If you have questions about testing or locations, please visit darenc.com/COVID-testing or call the COVID-19 call center, open Monday through Friday from 8:30 a.m. to 5 p.m. at 252-475-5008. We encourage you to stay informed by visiting darenc.com/COVID19 or by visiting the CDC or NCDHHS websites. Again, if you have specific needs or questions, you may also call the Dare County COVID-19 call center, open Monday through Friday from 8:30 a.m. to 5 p.m. at 252-475-5008. Thank you.